감사합니다. 안녕하세요. It's all the Korean I know, so sorry about that. And I don't have any scholarships to give like Dr. Chang, so hope you bear with me. Thank you very much for having me here today. My talk today is going to look at the very exciting potential of new media technologies to visualize our past, our present, and our future. And my contention is that these simulations can have a transformative impact on human health. And I'm going to show you some case studies and some examples of both research and other projects that I've done to this effect. So I thought I would start out by looking at healthcare as a puzzle. It's a puzzle that all of us in healthcare try to solve every single day. And for most of us in the healthcare industry, it's like solving a puzzle of, you're performing a procedure. If there's a tumor inside your prostate, you go to your great Da Vinci machine that you have here at Seoul National University Hospital, and you cut it out with the laparoscopic instruments, and you're kind of done. So this is kind of an engineering problem that we solve every day. And unfortunately, this works really well in the hospital, but it doesn't work so great in the home environment. In the home environment, in this smart home that we want to engineer, the problem that we're facing is something a lot more complicated. So a puzzle in the home environment that the smart home has to address is something like this. And this is an art piece by an American artist named Pete Fecto. And he creates these images with Rubik's Cubes. So these puzzles become pixel elements into a larger image. So if you can imagine and think of the problems that health in general, health and wellness, it's something that you have a lot of different factors to address. There's the factor of randomness, right? Things that sort of happen. You've got the factor of things happening over a long period of time. So it's not that you eat a hamburger and you get fat. You eat a hamburger every day with fries and extra ketchup and mayo for the next 9 months, as Morgan Spurlock did in his film Super Size Me. That cumulative effect comes into play. There are also probabilities. So you can smoke every day and not get cancer, and somebody who's never smoked can get lung cancer. So all these different complexities constitute something that's called an evolving system problem. This is something that can't be solved with a magic pill. This is something that just can't be solved with a single intervention. It's something that requires a lot more creativity and something that requires this participation and engagement, not just from patients, but from us as providers as well. So if we look at this kind of spectrum that we all are going on in the course of our lives and what our patients are going through, at any moment in our lives, we can take steps that will be an intervention to take us on a healthier lifestyle. You can see this increased vitality, more energy, reversing chronic conditions like diabetes and obesity, and living a longer and more productive life. Or we can do things on a day-to-day basis that will take us on this other track that will lead to these conditions as you see here. This is a graphic that was created by the Visual MD, a really fantastic company in New York, run by Alexander Ciares. And I think it's a great visualization of this time frame. It's very hard for us as human beings who live in this very linear, day-by-day, hour-by-hour, minute-by-minute basis to kind of think into the future. And in psychology, the idea of relating to your future self is something that's very complicated. We tend not to be very good to our future selves, right? We're like, okay, well, that fat guy on the bike, that's not me. That can't be me. You kind of don't relate to it, but it could be you someday, right? How do you kind of create this sense of empathy between your present self and your future self? And that's something I think technology has a huge opportunity to allow us to have that bridge. So I started a company called Medical Avatar, and we visualize people's health information by creating a 3D anatomical version of them. And one key component of this application is this timeline. So you can travel in the past and look at all your past health information and have a real record of your medical history in a way that's very difficult to do with the kind of paper and other ways that we try to record all the day-to-day type of things that make a big impact on our life. And we have the ability to pull in information from the physician's office or from a hospital visit through this continuity of care record, which is a standard in the United States. And this personalization we feel is a really crucial bit of it. This application, we imagine it as almost like a mirror that you might look into when you wake up in the morning, and instead of just seeing your face and seeing how your hair looks, you'd be able to see all this past health information, present health information, things you can do today to make today a better and healthier and happier day. And all those components come into play into something that you can really weave into your lifestyle by seeing this visualization of yourself. it's not just some random person with heart disease, it's you with heart disease or you with the potential for heart disease, and how can you avert that situation. And we combine this with medical imagery, medical content, and this anatomical visualization allows us to give an interface to all of our patients that is at least somewhat familiar to them. You know, you might not be completely familiar with your inner workings, but you at least kind of know where your general parts of your body are. And if you can relate to that in some way, that becomes a very powerful vehicle for sharing information that's very personalized and very relevant. So I wanted to start with a case study of how we're trying to capture this patient story and channel all this information that happens in the home environment, make it into a smarter sort of mechanism, and connect that to a provider. So what we've created here, I feel, will work both in the inpatient sort of the clinical visit setting, as well as via these e-visits where you can have some sort of Skype or other video conferencing approach towards communication between the patient and the physician. And here I just want to share with you a very short snippet, and this patient kind of pushes the boundaries of the time limits of the e-visit because she has a lot of information, a lot of symptoms to convey, and this is just a very, very small snippet. So let's listen.
I was having the dizziness, the nausea, the headaches. I was going on about 10 years of that, and I really noticed it in the wintertime. I started experiencing anxiety attacks. I was to the point every night I'd sleep with headphones on to try to relax my body enough that I would be able to sleep.
So does anyone have a diagnosis or just an initial idea, right? So obviously you'd have to run tests, and you do a physical examination ideally. But just from that little snippet, can anyone guess maybe what she's suffering from? What would you say? She's like anxiety, dizziness, any ideas? No clue. And that's the same sentiment that many physicians, she went to doctor after doctor, in-person visits, e-visits, kept getting different diagnostics, different diagnoses on her condition, and it became such a stressful situation that her chief complaint became anxiety, and that's what she was being treated for, but there was some sort of root problem that we couldn't get to. So we thought she was a really great case study. We sat down with her, and a lot of this was on her own initiative. She started tracking all of her symptoms. And before she would show up at the doctor's office with like pages and pages of her symptoms, or when it was e-visit, she would email the doctor one of those like 20-page Word, like she would send like a 20-page Word document as an attachment to an email, and the doctor would have to kind of sift through it. Really horrible situation. So we took all those symptoms and we allowed her to visualize that information. So every time she experienced something that she would normally write down, she would instead tap on the part of her body that was being affected by that symptom, indicate the level of severity, and say like, oh, it's like a flashing pain. So she would sort of mark it there, or it's just sort of this general area here. So she can choose a shape that represents that pain in some capacity. And then she can put in some of her notes. And her notes became much shorter in this format than in the sort of large Word document that she was more accustomed to. So we started plotting all those different symptoms onto the timeline. So what you see at the top of the screen are the different symptoms labeled by the color that she selected, that she felt represented the pain. You can see the spikes that indicate the level of severity. So the jaw pain got really bad at the intervals that you see in red at the top. The stomach ache was sort of a constant complaint. It got really bad somewhere between May and June, but then kind of leveled down, but it's still been there. Hip pain, shoulder pain. And as you move your finger across the timeline, the symptoms sort of pop up and appear on the body at the different sizes, indicating the severity. So here, when she started using this app in these clinical visits, whether it was online or in person, immediately she would start talking, but then it became a conversation. It wasn't just her listing out all these symptoms. The physician would say, oh, well, what's going on here? Or let's look at this time period. And this became a point of sharing information in a much more dynamic and visual way that was not possible in the way that was occurring prior to having this tool at her disposal. So it became a tool for her to be expressive, for her to be able to tell her story in a compelling way that actually, as you'll see here, led to a diagnosis. So here on our website, she didn't want to be featured on the website. She said it was okay for me to play that video for you guys. But here we sort of transformed her into Karina. So this is our fake version of her, but this is actually her story. And as we went through, we totaled up all of her bills from the e-visits, the in-person visits, all the diagnostics that she had. And this is the bill from the past year of all the different services that she incurred. A lot of it was paid by insurance companies, by her insurance company, but a lot of it was also out of pocket for various reasons. And so after going through this process, and we got all the information in there, and we said, okay, now you've got the symptom tracking, this visualization of your health story. Let's do, and in this case, we did an in-person visit with a physician, kind of went through it. It was the same time frame in the US. Typically, it's 10, 15 minutes tops that a physician might have with his or her patient. In that short time frame, they started going through all these symptoms, going through the timeline back and forth. And what this physician, maybe this was just a great physician, but he, I think he's a great physician, but we think he's fairly typical. Primary care physician looked through all the symptoms and started noticing a pattern of very specific symptoms on top of everything else. So keep in mind, she's still experiencing this anxiety, the jaw pain, hip pain, like all kinds of stuff, headaches, dizzy, nausea. But the physician started noticing one particular line in the timeline, and it was this pleuritic chest pain. It was this shortness of breath, these ongoing kind of rapid breathing. He's like, well, what's going on here? And they started isolating, and he sort of hid all the other symptoms and just looked at that. And sure enough, she was diagnosed with a pulmonary embolism. And so he ran the correct diagnosis, the diagnostic test, made that diagnosis, she received the treatment, and it was a much quicker process. So it was very satisfying. This was one of our kind of archetypal best case scenarios where she went through this very long process in the clinical healthcare, in the whole healthcare system, and she was able to, in just one single visit, accomplish something that she was not able to do in this very long time frame. So we're hoping to apply this to more patients. We have a pilot program with a couple different insurance companies trying to identify mostly kind of chronic disease patients who seem to have kind of new conditions and new issues constantly coming up, and seeing if we can have that same impact on improving diagnoses and also reducing the number of unnecessary medical procedures. She went through so many different medications. I just checked in with her the other day, and all the anxiety disorders kind of went away after she was diagnosed and treated for the embolism. And then after the anxiety went away, then so did the stomach pains and the hip pains and the dizziness and everything else. And that's what she was being treated for. So that was the engineering problem that they're trying to fix, all those kind of symptoms. And they weren't able to find the actual cause until you got a full, complete picture of what was going on with that patient. So I want to share with you another patient story which I think illuminates really the powerful impact of being able to tell your story, to take everything that happens in your home environment in the rest of your life outside the hospital and apply it in a very powerful way when you do have to work with the provider. So Katie McCurdy is a patient, and she's also the Chief Patient Experience Officer at Medical Avatar, primarily from her experiences both going through the healthcare system, but also as a really amazing user experience designer. So as Dr. Cavazzo was telling you, the impact, the importance of the design interface is something that I hold very dear to my heart, and something that I've worked very closely with to make sure that everything we create is patient-centered first and foremost. So this was Katie as a young girl, like around age 13. And this is, she's kind of smiling. And over the years, she started losing control over her facial muscles. And through this very long process, she was eventually diagnosed with an autoimmune disorder. It was myasthenia gravis. And you can see here, she's not able to smile at all. This is her attempt at trying to smile. You can see there's a little bit of drooping in her eye. And she started tracking these facial changes because she started complaining about this. She started noticing this. But when she would show up at the physician's office, she was able to control her muscles a little bit better. And she's like, no, just yesterday, I couldn't even smile. My eye was drooping. And the doctor's like, well, you look fine. I don't know what to tell you. So she started taking pictures. And so this is a very smart way of her recording what was going on at home and immediately communicating to the physician. And this was something we also kind of mapped to a timeline. You can kind of scroll through and kind of see those changes. And it's just not an isolated incident. If you kind of go through these pictures, you'll notice that this is happening quite a bit. But the physician has no way of knowing the frequency, the intensity, the severity without having a lengthier conversation at times. But visually, you get that right away. So what we also did, and what we're applying into the app that I think is also an important part of this, is taking that timeline, and this is just a little bit more of a close-up, where this timeline we decided to say, okay, and this is all Katie's work, so Katie decided in the top part of the graph was when she's feeling better, and below is when she's not feeling as well. So right away you can say, okay, well, so far she has this sort of issue as a young baby. Everything's doing great. Something really bad happened. This kind of nervous stomach. And the blue line's when she was diagnosed with the myasthenia gravis. And so you can see where the episodes get really bad, where things are under control. And just imagine trying to communicate all of this information. She goes to new doctors relatively frequently. Being able to have this visualization was such an important way for her to be able to have a dialogue, to tell everything that she needed to tell this is all relevant information. Whatever she's suffering from now may be related in some manner, and she found that to be the case as she went from physician to physician. So this is Katie today, and because of her high level of engagement, her high level of adherence to this process, and her own active, creative way of telling her medical story, she has been dealing with this condition very effectively. This is her speaking at a Stanford event, this Medicine X event last year. She's going again this year. She got married recently, so this is from her wedding. And this is a patient with an autoimmune disorder who has like muscle problems, and yet she was able to climb Yosemite Half Dome. So this is a really remarkable person, a remarkable patient who has really used her talents as a designer to transform herself from being this patient who's been suffering from this terrible condition to somebody who's living a full and happy life. And we want to take those same principles and apply that to the technologies and tools we want to build for patients in their home environment. One really exciting part, and this led to our collaboration, was that Katie would also do these drawings and mapping her symptoms. And so she's been instrumental in designing the Symptom Tracker piece that you saw earlier. And it started with this kind of avatar she drew of herself. So it's sort of a kind of a scary alien-like creature, but it became such a really important visual focus for her to be able to say what was going on. Again, imagine trying to explain all these symptoms. It's like our original patient, Anne, where she's just kind of talking about symptom after symptom after symptom. Here, in just one quick shot, you as a clinician can take a look and say, oh, well, tell me more about the kind of tingly feeling in your legs, or I'm really concerned about this sort of breathing issue, and identify that without having to go through a very lengthy explanation. This visual representation on this body became a fantastic way for her to be able to communicate a large volume of information with simplicity. So what you're seeing here is something I noticed after kind of coming up with the avatar concept.
Scarring along the durometer.
So again, you have the avatar, this visualization, as a mechanism to help in this dialogue, in this diagnostic process between patient and physician. So I remember coming up with the avatar idea, seeing this TV show, and people always focus on the medical tricorder technology in Star Trek, but I think this holographic visualization of patient anatomy as a mechanism for diagnosis and treatment of that individual is an even more powerful concept in many ways. So with Medical Avatar, this is part of a commercial that we're releasing with Oakwood Healthcare. We're working with providers to offer this technology to their patients. So our business model is that we're licensing the technology to hospitals, but then the hospitals give it for free to their patients or to even prospective patients. So there's a marketing component to it, and then there's also a patient engagement component to it once the individual starts using the application. So you can see here, this is also an actual patient suffering from some shoulder pain, one of their orthopedic patients. You can see how we created this 3D anatomical model of that individual. All the health information offered by the hospital is connected to that person. So instead of going to the website and digging in and trying to find the information that may be relevant to you, all of the information is fed through an XML feed into the avatar, so you're seeing like the whole hospital website, but your view of the hospital website. I've spent maybe 15 to 20 years designing hospital websites, and everyone wants, if you look at the homepage, even the institution's homepage, it's where you're trying to be everything for everybody, right? Which is really hard. Here you have the ability to create the same sort of functionality as a patient portal, but without having to log in, the security and all of that, because it's just the patient entering in their own information. They can connect to the kind of patient portal, internal health information, CCDs, through secure channels, but there's also value and ways to track your own information outside of that. So it's really the best of both worlds and taking advantage of what you can do on mobile technologies that you can't really do on a website. And if you want to download the app, I'm going to show you, it's oakwood.org/avatar is a site where you can link into the iTunes store. So just to give you a kind of quick view of what happens here. So this is the patient at home, sitting on her sofa, taking a picture of herself. And we take that photograph, and you can see how we sort of line up to the image, and we create a three-dimensional model from that photograph. This is using technology that we licensed from a company called FaceGen that actually does a lot of video game technology development work. So you create your avatar, the star of your medical story. We do this head transplant onto this 3D anatomical body with all these different systems that you can turn on or off and see your body in this kind of 3D view. The actual shape and size of the body is customizable based on your body type. So you can see here, you can make the body more obese or leaner. You can also enter in, say, the clothing sizes, and your body will sort of transform to sort of match what your body actually looks like. And we're continuing to revise how this works. And you can see the health information that this patient is putting in here. And when you tap on or look at certain piece of information, those relevant areas of the anatomy start to light up, and you can see the information connected to the relevant parts of your body. So again, the timeline component, we've been talking more about past medical history. What about the future? I promised you time travel discussion. So how are we going to do this? We've been working on some algorithms that are based on regression analysis. So you're looking at this past data and looking at those factors and making predictions. Given this factor, this may be likely to occur. But the aspect of this that I'm most interested in is how can you create these visualizations of the future as a way to motivate potential behavior change today? And that's sort of a lofty promise. Behavior change is something really hard to enact. And Ebenezer Scrooge, I think, is a great example of a curmudgeon, a very difficult patient. Imagine having Ebenezer Scrooge come into your office and demand treatment. Probably the least engaged, non-compliant patient you can possibly imagine. But through the power of time travel, the ghost of the future, Christmas future, he saw his future and was shocked by what a terrible person he was and the implications of his actions way back in the day. And he transformed from this awful, terrible, selfish person to this father figure to Tiny Tim and learned to love Christmas. There was a really great elementary school play, I think elementary school or middle school play, where instead of doing the Christmas Carol, they did the Smoking Carol. So in the Smoking Carol, Ebenezer Scrooge was a smoker, and he had to go into the future and see what he was like suffering from lung cancer and all these horrible things, and that awakened him, and he stopped smoking at the end. So I'm trying to find footage of that, but I thought that was a great reinterpretation of A Christmas Carol. So what are the real-world implications of this time travel? There's a wonderful lab led by Jeremy Bailenson at Stanford University that is doing studies on how avatars, especially this sort of time-traveling avatar, can really influence our behavior and the way we think about ourselves, our past, and our future. Dr. Hirschfeld in that lab did this really wonderful study looking at participants who would interact with a future version of themselves, and they would have this sort of conversation, get into more details about the research design, but essentially after having this interaction with a sort of future version of yourself, he wanted to see if that intervention would make you more likely to save money for the future. Right? So if you can actually get to know this future self, would you want to save some money for him or her, or would you be less likely to spend all your money kind of today? And the results do seem to suggest, like, hey, if you kind of see yourself in the future, yeah, maybe I'm going to think ahead and I'll plan ahead because I want to be good to this guy. So let's be good to this future version of myself and not be so selfish and live purely in the present. So I want to apply this principle to an issue that it's still pretty relevant and still a big concern for healthcare providers and payers in the United States, and that's smoking. So this is a new study that I'm working on at Columbia to really address this huge concern. This is from 2000-2004. The trend does seem to be kind of positive, but smoking is still responsible for, it's still the single most preventable cause of death and disease in our country and I think elsewhere in the world. And the public health response tends to be stuff like this. And this is actually an attempt to change from just text-based labels to visual imagery. That's pretty disturbing. And this was actually declared illegal, wasn't permitted by the U.S. courts because you're sort of imposing this restriction or you're putting this imposition on the manufacturers and forcing them to label their products in a way that is not what they would necessarily choose. And I don't know how that's different from the text labeling, but for whatever reason, this was not permitted in our country. The top row, the bottom row was an actual poster campaign that occurred in New York City. But to really change behavior, I think people look at those commercials, maybe it has a positive impact, they keep doing it, so there is some evidence suggesting that there is a positive impact. But I feel it's still superficial. People would see these kind of gross images and go, okay, well that's not me, I'll quit smoking someday, it's no big deal. So if you're really talking about changing health behavior, this is something that we heard earlier from Dr. Kevdar, is that you have to really think about these different stages of transformation. And even people who say, oh, I quit cold turkey, more than likely there were these stages leading up to that moment that cause that change, and it's this iterative process kind of going back and forth. So this is James Prochaska at the University of Rhode Island, his trans-theoretical model for how we can really enact behavioral change, and that's a principle that we apply as well into the way that we think about our applications. So in this particular study, I'm interested in these early stages. How do you get people to start thinking about smoking? And we identify smoking participants who just are folks who say, I smoke, I'm happy to smoke, I'm going to continue smoking, I may decide to quit someday, but I'm not there yet, and you can't make me. This study was also inspired by a friend of mine who's actually a pulmonologist, and I saw her in front of the hospital one day, and she was smoking a cigarette. And I was like, you're a pulmonologist, why are you smoking a cigarette? And she's like, I love smoking, and I'm not going to make any excuses about it. I remember too that she also suffers from asthma. So there was that morning she was puffing on her cigarette, she started coughing, and then she would blow in her inhaler, be able to breathe again, and then smoke again. So it was just kind of back and forth. I think it's like a fire hazard, right? You can like set something on fire, set herself on fire. So I asked her to be one of my pilot study participants, and she kind of went through this whole process, and I knew that she was very skeptical. She had no intention of quitting. She was like, look, I know all this stuff. I'm a pulmonologist, so you can talk about the effects of smoking in the body until you turn blue. I know this, just whatever, but I'll help you out. So in the study, I created 3 conditions. One is where you're just listening to an audio recording, something that you as a clinician might say to your patient to get them to quit smoking, like, look, here's what's going on, and when you take a puff of a cigarette, the effects of nicotine, the effects of the smoke itself, and all the carcinogenic effects. And then I thought, okay, well, what if we combine them with visuals? Because there's a lot of kind of thought in public health circles about, oh, well, if we can kind of show people things, and the visual kind of component in psychology, this sort of duo encoding. Duo encoding is a theory that, hey, if you combine text with images, you're more likely to get people to remember whatever it is that you're talking about and to learn better. But in the third condition, I thought, hey, let's try something kind of new and exciting to me. Let's have the same text, the same audio that you're listening to. Let's use some of that imagery, but let's create this additional factor of embodied cognition. And embodiment is where you're using your body to really learn and think about and process information. So one example is if you're learning math for the first time as a 5-year-old, what do you do when you're learning math, right? You're counting, you're using your fingers, right? So this is one form of embodied cognition. It's a way for you to be able to think and look at information and use your body in that cognitive process. So how can we do this? So I created this little quasi-medical device. This is an example of some of the art projects that I do that I try to apply into some actual research purpose. So it's a device, you stick your hand inside this sort of container, and there's an iPad on top of it, and the camera's activated, so you're seeing a live video image of your hand, right, inside the iPad. You're like, okay, you're cool. And then gradually you're looking at your hand, and then the hand starts to age as you're hearing about the aging effects of smoking on your skin. So you're like, oh, okay, there's my hand, and now this is not looking so good. And so the wrinkling effects, you're just not hearing that, oh, smoking causes wrinkles. You're actually seeing that on your own hand. You're moving your hand around, and you're seeing the wrinkles kind of stretch in the veins, and your fingernails are a mess. Wow, really, really gross. So it's the same gross images that we saw in the cigarette boxes, but it's your hand now. This is your body that's being affected. As you're hearing about the bone density loss due to smoking, you're actually seeing the kind of skeletal, like your metacarpals. You can see the bones actually sort of deteriorating a little bit. We try to keep it as realistic as possible. When you hear about blood constriction, you're actually seeing the vessels in your hand getting kind of smaller and smaller and smaller. And one participant was saying, actually I thought that smoking is good for your heart, it's good for your cardiovascular system because it's stimulating. Right, gets the blood flowing. Yeah, when I have a cigarette, I feel much better. I feel my heart going. Smoking's really good for my heart. And after seeing this, he remembered very, concretely now. He knows that smoking, in fact, is not good for your cardiovascular system. So, stop smoking. And so, related conditions, amputations due to diabetic complications from smoking. And imagine just seeing that. And this is something that's pretty disturbing. Looking down, seeing kind of fingers missing from your own hand. So the results from this, I do have a pre-test where I kind of assess prior knowledge and kind of smoking dependency. There's a scale that I use for that. And then in the measurements, there's a free recall task where I just ask people to just say everything that they remember from the text. And so this is, I converted this to a digital format for analysis. So you can see in the blue, that's where they actually remembered something that was in fact in the recording. And then the brown area is, stuff that was not, that they sort of made up. I don't know where it came from. So all those intrusion errors. And you can see here, there is a significant difference in terms of the embodied cognition. The images, that's almost significantly different, a little bit more, but the embodiment, you're seeing a very large difference in terms of memory of the health information. Hopefully, remembering things will also kind of transfer. I mean, there's other studies that we'd have to follow up with. So then they had a recognition task where we actually listed out kind of true or false questions, and they had to say yes or no whether or not that information was what was presented there. And again, you can see the embodied cognition was very significantly improved over those other two. So when I started with this study, I thought, there are all these great skin cancer studies showing how, when you show wrinkling on the face, you just showing somebody like a melanoma maybe isn't a great way of dissuading them from staying out of the sun, but when they can see the wrinkling effects, that might be a way of doing it. So I thought, it's all about the face. We'll do the face aging stuff. That's going to be really powerful. My pilot studies it just made no difference. People sort of forgot about it. But the hand, and this is my pulmonologist friend, kind of came back to me. She's like, okay, I went through your study, gave you some feedback, and all right, that's sort of freaky, seeing my hand all kind of aged and diseased. But now when I smoke, I did this in front of the hospital the other day. When I lit the cigarette, I'm looking at my hand. You're not looking in the mirror when you're smoking, you're just looking at your hand. And she's like, before I put the cigarette to my lips, I sort of paused and I put it down. I smoked later, but at that moment, I didn't smoke the cigarette. So I don't have evidence and proof that this will stop people from smoking, but it's a start. And I'm hoping to do additional studies to see how various aspects of this embodied cognition state could be applied to devices in the smart home or to other applications that patients could use to really think about their health in new and novel ways. I still feel there's power in this medical reflection of oneself, this kind of future reflection of yourself. This is from a campaign that was done by America's Top Model, a reality show in the US, where all the models posed with these sort of older versions of themselves. So this is a smoking cessation campaign that they did. And so you can see these beautiful models and what they look like, in the future using this medical reflection. And there's a lot of public health efforts that are taking the same principle. This is some images that are on the American Cancer Society's website where they took these twins, and where one twin was a smoker and one was not, and taking photos of themselves just to of these two individuals to show the differences and the effects of smoking. So I thought this was a really interesting approach. And what if we can actually create the sort of older twin version of a patient through the technology? So here you've got this, and this is another one of my earlier studies where you're, and it was a pilot study, so you're looking at health information and you're seeing it sort of in sort of your own body versus sort of seeing this information just in a generic representation or seeing this in a future state. So if you're learning about atherosclerosis or these other kind of heart conditions and you're seeing it inside the body of an older version of you that might actually have these heart issues, does it have a stronger impact in terms of how you process that information? And so these are some of the aging avatars I've created. Each of these individuals, it's matching those study participants. So it's not just random pretty people. This is you and seeing your anatomy, your face, and an older version of yourself. Another study in the Jeremy Balanson lab, and Dr. Yee was the lead author on this, was looking at the idea of the Proteus Effect. So the Proteus Effect is the idea that an avatar, a representation of you, can actually influence your behavior. And some of their early studies are really fascinating. I really encourage everyone to take a look at their body of work. They had these studies where some of it was in Second Life, some of it was with these other multi-user learning environments, where even if an avatar of a person was taller or better looking or whatever, they were attributed more positive characteristics. So even though their behavior might have been whatever, if they look better, if they're taller, they seem more authoritative. And so it's really interesting to see those responses. In this particular study, the image here, an avatar of yourself would be sort of like running, exercising, visualizing some of the changes and potential changes of an exercise program compared to a sedentary representation, and visualizing your actual activity through these avatars and seeing if this sort of additional visualization of sort of the past and sort of future positive consequences of what you do, does that make an impact in terms of maintaining and staying on this sort of exercise program? And so this also yields some very positive results in terms of the exercising avatar, reinforcing your behavior with a record, a visual avatar record of your activities had a very positive effect. So I wanted to apply this to the idea of time traveling into your own body again within the tools that we're building in the smart home environment. And so health and wellness is another aspect of the work that we're doing. This is still pretty preliminary, but we're looking at some of these different factors and looking at the huge body of mobile apps designed for weight management, diet, exercise that's out there, seeing kind of what works, what doesn't work. And a lot of it is very data-driven. You see a lot of charts and graphs and things like that, which I think is great. But there's nothing that's actually recording your physical changes. And I like the idea of taking these photographs. I actually used to be 220 some pounds, so that's much heavier. My suit, I had another suit that was like this wide. And it wasn't until I started kind of taking pictures, trying different things, visualizing the effects over time, that I actually started getting a handle on my weight and thinking about my life and my body and my health in some sort of effective manner. And so what we want to do with the avatar is to be able to show those effects, not just through photographs, because there's still this sort of body dysmorphia that a lot of us go through. I still feel like a fat kid. Starting to gain a little bit of weight now from all the great food that we've been having this week. But by having this 3D representation, then it's something that's maybe a little bit more objective. We can start to see ourselves, get a little bit of distance and be a little bit more objective on what we're doing and how we are improving our health. And she was a lawyer who came to a great amount of prominence through her advocacy for children with cancer. There are many cases where insurance companies were denying coverage for these kids with cancer, and she fought, and everyone thought she could not win the case, and she did. Unfortunately, she was diagnosed with multiple sclerosis. She had suffered a brain lesion while she was on the playground with her 2 kids, and the entire process of going through this was something that robbed her of her speech. So you can imagine a lawyer not being able to talk, really a horrible, horrible situation, and obviously a pretty poor prognosis. And she was pretty depressed one day, and she decided to just kind of stop by this workshop that was being held at the hospital. It was an art workshop, and it was a silk screening class, and she thought, hey, well, I've been getting all these MRIs of my brain. Why don't I kind of use that and make some art out of it? And this became an obsession that she took back home. She took all of her images and she started creating a series of these paintings that documented her changing brain as a result of her condition over the days, months, and years that she was suffering from multiple sclerosis. And these images became a way for her to share her experience and share these images in a way that's kind of beautiful, and allowed her to process her disease in a very creative and expressive manner. So these are just some of the examples of the work that she's created over the years. She had an exhibition at Harvard's Neuroscience Research Institute, I think pretty recently. So this is the exhibition there. And I think she's a great example of how you can provide some sort of tool or activity to a patient that really enriches their life in a way above and beyond what we typically do as people in the healthcare world. And if we can draw some important lessons from this, that this is something that has such a crucial factor in the patient's ability to deal with their condition in a constructive and responsive way. The final patient story is my mom, so I really appreciated Dr. Cavazzo sharing some of his family pictures as well. My mom has been an inspiration for a lot of my work, and she's also an artist, so I learned to paint and draw from her. So this is one of her paintings. You know, it's pretty good, right? This is a very like a gongbi technique, a very kind of precise brush painting style that she's pretty good at. And as an artist, she received a pretty terrible diagnosis a number of years ago, where as she was painting, one day she noticed that her vision started to sort of dim. She went to an ophthalmologist, and they weren't sure what was going on, and eventually she was diagnosed with a brain tumor. So she was suffering from this non-Hodgkin's lymphoma. You can actually see the tumor in the back of the eye there that's pointed out in the avatar, and some of the treatment. And so much of the work that I've been doing with Medical Avatar was drawn from that experience of caring for my mom, recording all this information, trying to make sense of what was happening. Something like non-Hodgkin's lymphoma is not just a sort of quick engineering problem. This is a situation where she was dealing with chemotherapy and treatment over a very long period of time. And so there's a lot of information to process, and my attempt as a designer was trying to make sense of it and apply it in some sort of constructive manner. And what really struck me was during this process, when she almost lost her sight completely, she said, well, okay, if I'm blind and I'm no longer able to paint, I'll take up sculpture. And so that was her response as an individual to a really horrible and detrimental situation. So it really inspired me to think about what are ways that, just whatever the circumstances are, how can we really accommodate the needs and allow patients to continue doing what they need to do to be full and complete people. As my mom started regaining her sight, she took up calligraphy, and so she said, okay, I may be like 70 some years old right now, but maybe I'll live for another 10 years, 10, 15 years. And if I practice calligraphy every single day, maybe I'll be pretty darn good in 10 or 15 years. And so it's this sort of activity that's really driving her health, her happiness, her well-being on a day-to-day basis. And she really believes that her cancer came from a lot of unhappiness that she experienced. And she's like, that's it. This is a new lease on life. I'm going to find a way to be happy, to live my life the way that I want to live my life. And I find a lot of inspiration from that. So this is my mom recently, me and her. And you can see she's doing much better. Pretty happy. And I wanted to close with a slide of my parents. There's my father and my mother together. And I thought this would be a nice closing slide for two reasons. One is that you can say that you can often see your future in your parents. Many of my study participants that experience this progressive simulated aging would look at their future self and go, oh my God, that's my mom, or that's my dad. So it becomes a sort of point of reference for that individual. But secondly, they've always taught me, and they're both teachers, they always said if you give students, if you give people the tools that they need to be creative, to do amazing things, that's where you're going to get the biggest impact. And I really hope that that's a lesson that we can all instill inside ourselves as healthcare providers to really allow our patients to live happier and healthier lives. Great, thank you very much.